Hey everyone, welcome to another episode of our Facebook Live interview series. I'm your host, Erica Anderson with the National Spine Health Foundation, and I'm so excited to bring you this conversation with one of the spine surgeons at the Virginia Spine Institute, Dr. Jazini. Thank you so much for joining us, Dr. Jazini.
Thanks for having me. Very excited
Yeah.
to be on the air with you guys.
Yeah, we are excited that you took time out of your very busy schedule to chat with us a little bit today about some of the research you've been doing. But before we get started, just tell us a bit about what you do there and how long you've worked at VSI.
So I'm a spine surgeon here at VSI. I've been here for a little bit over 2 years. I joined after being at Georgetown University as an assistant professor doing spine surgery there. And the reason I joined Virginia Spine is because this is the perfect balance between ultimate amazing care, where we really take care of the patient as a whole. We have interdisciplinary teams where we really take care of the patient as a whole, and not just with spine surgery, but with regenerative therapy, with the best spinal therapist that you can ask for, as well as neurology. And when you're talking about spine care, you really have to have all these aspects, and then we have them under one roof. So I can go down the hall and speak to the right specialist and work as a team to really take care of the patient. Because really what we care about here is to get the patient back to what they love to do. And on top of that, we have research. Believe it or not, I have the ability to do multiple studies. We have over 20 studies ongoing here at Virginia Spine Institute, and I couldn't do any of these at Georgetown University. I didn't have the time or the resources to be able to do that. So that's why I joined, and it's been an incredible journey so far.
Yeah, that research component is so important, and it's one of the main things that we focus over at the foundation. And so I want to talk with you a little bit about some of that. Last year, you presented some results on a study that you're involved with us on enhanced recovery after surgery. Can you tell us, also known as ERAS, ERAS, tell us a little bit about your work with ERAS and how you became interested in that line of research?
Absolutely. I'm very excited to talk to you about that because, spine surgery is very important. Our techniques are important. The technology is very important. But what happens afterwards, right? Often not surgeons just take care of the patient in terms of the surgery, but then the recovery is just left to someone else. And so what we're doing with ERAS is how do we get the patient to recover faster? How do we take care of them after we've done this amazing work on them? And so this study is looking at a set of protocols that have been established in other fields that we are the pioneers of in spine surgery here at Virginia Spine Institute, and working with other centers to look at how are these patients doing after we implement these protocols. So the best way I talk to my patients about this is surgery is like a marathon, and you really need to have the proper preparation for it, both before it and after, so that you can recover from it. And so we focus on nutrition, we focus on therapy, we focus on how to get patients up and moving within 2 hours after surgery. We work with our anesthesiologist to make sure they have the proper fluid balance. And then we also work with our spinal therapist to help them mobilize and get them up and moving faster. And what we found is by starting these protocols, patients are leaving the hospital faster, they're staying in the hospital less than they were before. They're able to remove the catheter, the Foley catheter, so that patients can pee. They're removed faster, so we're cutting down on UTIs, and ultimately we're helping patients recover a lot faster.
And what has been sort of the trajectory? Sort of like you've gone from, what's the expected recovery time for someone that goes in for surgery?
So we've been able to cut down. So it depends on the surgery, right? If you talk about the more common low back surgery that we do, the length of stay is usually about 2 to 3 days, and we were able to reduce that by a whole day. So that's incredible if you think about that in terms of the difference that you can get with ERAS. And because of how incredible it is, we're actually leading over 20 sites now to do a multi-center study with over 40,000 patients. So that's going to be a landmark study, and I think it just shows that if other surgeons can adopt what we're doing here, we can really improve patients' care for their recovery.
Yeah, well, that's definitely great news for so many people who are going to be going through back and neck surgery in the future. I want to also talk about another piece of research that you've been working on with us, which is the augmented reality study. Kind of sounds like science fiction meets reality, and kind of a more fun topic to talk about. Tell us, what exactly does augmented reality mean?
So augmented reality is like X-ray vision, right? When you look at the spine, you're only seeing the skin, unless you were able to strip down the skin and the muscle. You won't be able to see the bone and the anatomical features that a surgeon needs to see in order to do the surgery properly. So with augmented reality, you're seeing what you typically see, but you can also see everything underneath that. And what that allows us to do as surgeons is to minimize the amount of surgery we have to do, the amount of muscle dissection we have to do. And what that means for patients out there, right, is less pain after surgery, quicker recovery after surgery, and all the other negative aspects of surgery that you can think of, right? It's really how do we minimize the negative impacts of surgery so patients can get back to their lives. And we've been on the forefront of augmented reality with my partners, and especially Dr. Good. And we're doing some of the first surgeries in the world. I mean, I did the first augmented reality, something called laminectomy, where we remove some bone to take pressure off the nerves. We've been able to pioneer these studies, and we're going to report our results on the first 100 cases done to really show and demonstrate what I think the hypothesis of the study is, that patients are going to do better in terms of their recovery. The surgery is going to be faster and more efficient. The workflow is going to be more efficient. There's going to be less radiation to the staff, frankly, to myself, but to also the nursing staff in the operating room, and patients are going to go home faster. So that's the study that we've been working on. I'm really excited to share the results once that's available to us. But so far, it's been a groundbreaking technology in terms of what we can do, and I can only see more and more improvements as the iterations of this technology as it continues to improve.
One of the focuses that we had in the past year was minimally invasive surgery. That was what our big Spine Talks event was about this year. Is augmented reality a minimally invasive surgery? And what is what should people know about the difference between minimally invasive and regular surgery?
That's a great question. So yes, it's absolutely a minimally invasive surgery, right? Because I can see the anatomy of the spine without having to strip the muscles. I can minimize. Minimally invasive means that basically the surgery size, you're trying to minimize how much trauma you're causing in order to achieve the result that you're trying to do, the goals of surgery. You want to achieve the goals of surgery without causing any undue harm to the patient. So it allows us to have smaller incisions, but even less muscle dissection, which is really important, but being also much more accurate, right? If you have more accuracy, you have less chances that you can cause a problem. And so by using these technologies, we can make surgery more and more minimally invasive. That means getting patients back to what they want to do faster, getting them to walk faster, run faster, whatever their functional status was. We want to get them not only improved, but we don't want to delay that process from going about.
Now, what kinds of results have you seen from patients that you've worked on using the augmented reality?
The results have been incredible. I mean, I've done about 5 cases so far, over 100 screws, pedicle screws placed, and it's been 100% accurate, because we actually are doing something called a CT scan right afterwards to make sure that we can see how we're doing and measure that. And we've had 100% accuracy. The efficiency has dramatically improved, let's say over 50%. The workflow has been incredible. We've been really, really happy with this technology in terms of making us more efficient, producing better results for patients, and getting them out of the hospital faster.
And what can we look forward to in the future? What do you see coming down the pike with this?
I only see the applications of this improving in terms of being able to plan what we need to do, both before but as ongoing during surgery. Again, because you can see the anatomy so clearly and visibly using this technology, it only allows you to plan better, but also execute what you're planning. So the issues with the current technology, the older technology, is You can come up with a great plan, but the execution is always much harder as a surgeon because of the issues with not being able to see through the muscle or bone. Because I have this X-ray vision, right? I can see, okay, what kind of change did I affect for the patient live doing surgery. So I can only see that as the technology improves, our ability to do those things improve as well.
All right. Well, thank you so much, Dr. Jazini, for your expertise and just explaining a little bit to us about some of the great research that BSI and Spine Health Foundation are doing. We appreciate your time and all that you're doing for those of us who are suffering. So thank you so much.
Thank you very much for having me.